We would like to extend a warm welcome to those who are joining us today and those of you who will view this recorded webinar at a later date. This is the third of a series of 4 webinars offered in support of a grant project dedicated to enhancing the inclusion of emergency preparedness and response in public health and health-related areas of study. A few notes for you before we get started. This webinar is being recorded and will be placed on an emergency preparedness and response online curriculum hub. The Curriculum Hub, upon its completion this spring, will be a free and open source for emergency preparedness and response content and curricula. We look forward to engaging with those of you who have joined us today and will do so during the Q&A portion of the webinar, which will follow the presentation. That being said, feel free to add questions via the Q&A window throughout the presentation. We are joined today by students, faculty, and staff from Minnesota Private College Council member institutions, our partners from the Minnesota Department of Health, and representatives from the Minnesota State colleges and universities. Again, we're glad to have you with us. We begin with honor and respect for the land and for the first people of this land. We are on the ancestral homelands of the Dakota people. We desire to honor and respect the first people and recognize their caring for our common home. Other sovereign American Indian nations, including the Anishinaabe, also have a long history with these sacred lands, past, present, and future. We, both personally and collectively, continue to have a deepening awareness of our complicity of the complex history of colonialism, genocide, and broken treaties. We seek to understand the troubled acquisition of this land by unjust U.S. government practices, including the stealing of these lands and the first removal from the birthplace of the Dakota people without any compensation to the American Indian communities. We acknowledge the past, current, and future impacts of this history on our relationship with our American Indian sisters and brothers. During the next 30 to 35 minutes, you will learn about the mission and purpose of the Medical Reserve Corps program, membership requirements, and the MRC's commitment to developing a diverse volunteer corps capable of serving all communities. By the end of this webinar, we hope that you are able to take with you an understanding of volunteer roles within MRC activities and the impact MRC volunteers have on individuals and communities experiencing a public health emergency. This webinar and support for the overall EPR project is made possible through a grant from the CDC and is being administered by the Minnesota Department of Health. The project consultants for this EPR, the Emergency Preparedness Project, are Jenny Klesnick, my partner, who is not able to join us today, and my name is Kathy Berlin. I'm the project consultant, one of the project consultants, and I have my history with the Medical Reserve Corps is that I served as a coordinator for over 20 years. Brian Brown, my colleague from Ramsey County Public Health, will serve as the main presenter today. I'll be serving as the moderator, and I'll be start off the presentation by setting the scene. Imagine for a moment that you woke up this morning and while scrolling through the news on your cell phone, you became aware of a public health emergency that was occurring in your community. I imagine most of you would be thinking, how can I help, or where do I go to help out? Today, we are going to introduce you to a volunteer program that provides its members with the opportunity to be of service to their community during a public health emergency. A real-life example of this type of situation is when the 35W bridge collapsed. As the MRC coordinator of the University of Minnesota at the time, I was able to, upon the request of the lead response agency, deploy MRC Medical Reserve Corps volunteers within 45 minutes of the bridge collapsing. At the same time, I received a request for MRC volunteers from the city of Minneapolis. There were individuals not affiliated with the Medical Reserve Corps or any other formal organization who actually ran down to the bridge with the hope of helping out. As there was no way to identify their skills, credentials, or liability coverage, these individuals, for the most part, were turned away. To provide you with more details about the MRC volunteer program and how MRC volunteers are trained and prepared to respond to public health emergencies and support public health departments during non-emergency events, I will hand the presentation over to Brian.
Thank you, Kathy. I'm just going to share my screen real quick and we will get started. So thank you everyone for being here today. My name is Brian Brown and I work for St. Paul Ramsey County Public Health and have been with them since September of 2020. I am the Medical Reserve Corps Coordinator, also known as MRC, as well as an emergency preparedness specialist for our local public health agency. Today, we're going to talk about the MRC, its history, its current standing and structure, as well as look at my program during the pandemic and the struggles and lessons learned during that time. We will also talk about what a time commitment would look like, as well as training, why joining an MRC program could benefit you and your protections as a volunteer under state law. The MRC came about after the 9/11 terrorist attacks, and very similar to the situation that Kathy had mentioned with the 35W bridge collapse. Lots of individuals showed up to support response and recovery efforts, but due to the local leadership not having that capacity to coordinate and verify the credentials of those volunteers, many were turned away. This led to the formation of the MRC, where local jurisdictions could train, recruit, and deploy volunteers with the appropriate skills for the community health needs during a disaster. Currently, the MRC has about 300,000 volunteers at nearly 800 community-based organizations. Volunteers have been used in a wide variety of scenarios, from community vaccine clinics to veterinarian care and shelter operations, to many, many other examples as well. The current structure, currently the MRC is housed within the Administration for Strategic Preparedness and Response, also known as ASPR, and is this division of the U.S. Department of Health and Human Services. Many of the states have state coordinators, and most units are housed at local public health agencies, with a few that are at nonprofits and a few that are within higher education as well. The MRC in Minnesota specifically, we do have a state coordinator that's housed at the Minnesota Department of Health who helps guide our activities and supports us with grant requirements. We have 22 units in the states, with most at local public health agencies, but we do have a few specialized units like the Minnesota Behavioral Health MRC, which is actually a Tier 1 MRC unit that has been asked to deploy to other parts of the country, most recently to Guam. So talking a little bit about the Medical Reserve Corps of Ramsey County during our pandemic. Prior to the pandemic, our program was mostly unused, and this is mostly an alignment issue. If your leadership doesn't buy into your program, then the opportunities for those volunteers will become very limited. And during the pandemic, we did see a lot of interest in our organization, and we swelled to about 1,400 volunteers and actively deployed 540 volunteers. And this accounted for a taxpayer and county savings of nearly $750,000. So it's no small feat what our volunteers are able to provide and give, especially their time being so valuable. Some of the initial struggles that we saw with volunteers came at the beginning during our testing, as most volunteers in most organizations throughout the US are older retired professionals. And with the CDC guidance on who is at risk, many of our volunteers fell into that high risk category and were unable to be deployed to testing events for their safety. This caused us to rely on a very small pool of volunteers, but we were able to use our testing events to promote and recruit our MRC program. So taking the problem and turning it into a solution is the avenue that we took to get in new recruits. The second struggle we came across was the vaccine rollout mandates from the state that gave clear guidance on who was eligible to be vaccinated and at what time. Since our volunteers did not technically fall underneath the first responder category, we weren't allowed to vaccinate them. However, we were able to sidestep this issue a little, as the state had a no wasted doses mandate early on, and we used our volunteers as a call down roster to get vaccinated at the end of clinics when we had open doses left over. This really helped us utilize our volunteers when we began mass vaccination clinics for the general public in late February and early March of 2021. Our volunteers became the backbone of our response when the county services began opening up and staff were called back to fulfill their working obligations. The few lessons that we learned is that having a large, diverse pool of volunteer really helps to offset the fatigue and burnt out that many public health professionals felt during this time and are still feeling today. Having multilingual volunteers that can be recruited and trained as medical interpreters is vital to creating a self-sufficient infrastructure during public health emergencies. An example of having the benefits of having medical interpreters on site is that during our mass vaccination clinics in New Brighton, we have a large Vietnamese speaking population that lives and works there. Because every jurisdiction needed interpreters at that time, we would get interpreters, but not always the right interpreters for the day. So having an on-site interpreter meant that we could get an individual through our clinic in about 30 to 45 minutes, as we're having to use a telephone language service would double the time needed to get this individual through a clinic. So we're talking like an hour to an hour and a half to get a single individual through a mass vaccination clinic when someone who doesn't have a language need can get through in 30 to 45 minutes. These medical interpreters would also give us the ability to respond more quickly to communities that have barriers to access like languages, as those communities typically lag behind usual emergency response efforts. And if it weren't for our volunteers, we would not have been nearly successful at delivering vaccine care to our community. We did about 600 vaccine clinics from January of 2020 to May of 23, and nearly 80,000 doses that we gave. And of those 80,000 doses, our volunteers administer probably pretty close to 60,000 doses of those. So you can see that our volunteers were really crucial in our success. Now, time commitment. Since MRC units are volunteer-based, we don't put a time commitment on volunteering. We just ask that our volunteers stay engaged and support when available. How we do this is we offer annual flu clinics and wellness kit packaging for our outreach teams at our public health clinic as a way to keep our volunteers engaged. Now, we do have some time commitment because that lesson learned about medical interpreters, we actually put that into practice. So we started recruiting last year, and in our second year of recruiting, multilingual or bilingual individuals that we send to class and pay for their training to become certified medical interpreters. And then also we pay for a national examination for them as well. So in doing that, we do require those individuals to have a time commitment because we want to make sure that since we're paying for their training, we get some use out of them. And we have, because we've been able to deploy our volunteers to sites at flu clinics to help provide interpreting services on site during our vaccine clinics. So training varies between the jurisdictions, between organization and organization, but the CDC and ASPR have some great resources on where to start and when it comes to tailoring and onboarding for your organization. Currently, though, in Minnesota, the Minnesota Department of Health has asked the University of Minnesota to survey all the units in the state and then proposed a standardized training to adapt for all organizations. This is for the event of resource sharing. So if Hennepin County needs resources in the form of volunteers, when we send them volunteers that they know that they are going to get these base volunteers that have this basic understanding and training available, and they'll know how best to utilize them in their jurisdiction. So it will be up to the organization whether they add any trainings on as a part of their curriculum based on the jurisdictional needs. So we'll have that standardized training set by the state and then any add-ons. For my program specifically, we will require all these trainings listed for free to all of our volunteers. Most jurisdictions, all volunteer training is free to the volunteers. There's usually no out-of-pocket cost whatsoever. And we also provide the corresponding response kits. So if you come and attend one of our nasal Narcan or intramuscular naloxone trainings, you're going to leave with some Narcan. If you come to our Stop the Bleed training, you're going to leave with a Stop the Bleed kit that contains tourniquets and bandages so that in the event you come across somebody who has mass bleeding, you can respond and potentially save that person's life. So why joining an MRC can benefit you? It's a great way to network. Many of our volunteers have many years of experience in varied fields, And by making those connections, you could help in building out your professional network for job seeking. Also, many graduate programs like seeing volunteering on applicant resumes, as well as some programs require a certain amount of hours for volunteering for admissions into their programs. Many healthcare ones, I know PAs require, physician assistant programs require about 1,000 hours of patient care and patient care volunteering. So another way to really round out your resume if you're looking at graduate schools. And lastly, we're going to talk about volunteer protections. So the MRC's volunteers in our state are different than other volunteers. During a declared emergency, MRC volunteers are usually protected with the same liability and workers' compensation protections as employees. This means that if you are hurt while you're on assignment, your medical bills are paid for, and any lost time at work is also covered by the state. During a non-declared emergency, so our annual flu clinics, for instance, that falls on the jurisdiction to cover all those liability and worker compensations protections. This is why it's really important for your leadership to see your program benefit and to get their buy-in so that you can be covered to do this community work and respond. Without it, your program will be severely limited on its response capabilities and your program outreach and outcomes. So that's why it's really important to really show your program worth. And that's what we're trying to do at the county is connect with our leadership in our other divisions so that they can see the opportunities that we can provide their programs to support them in their everyday works. And I have references here for you all to take a look at later if you so choose. And that's really it about the MRC that I have. So I'm going to pass it back over to Kathy Berlin now. Kathy, you're muted.
All right, well, there I am muted. Now I was explaining that I'm having issues sharing my screen, which I'm going to try once more. Able to. Okay, well, I wanted to share photos with you, and there are multiple photos of MRC volunteers in action. And in the photo, and I'll try to pull this up again. In the photo, we have several pictures, 6 or 7 pictures of MRC volunteers in action. And in every photo, there's something in common. There's something in common that you would notice. And that commonality says something about the MRC program. We're going to come back to this concept when we're done with questions and answers, but I want you to think about, if I can get the photo up, just imagine that there's a photo. You can't see, these are pictures here in this screen of some volunteers. In action, one volunteer has masks on during a COVID vaccination clinic. And then there's a photo here of individuals from the University of Minnesota Medical Reserve Corps who were sent to Louisiana in response to the hurricanes in 2004, Rita and Katrina. And in most of the photos that I have of MRC volunteers, they're all smiling. So we'll talk a little bit about this when we're done with our questions and answers, which I can put that slide to come up in either. So we'd like to take time if anyone has some questions. Otherwise, I have some questions of my own that Brian's presentation sparked. Check to see if we have any questions here. Okay, so I will ask, I'll mention a question that I often get from students, collegiate students, and that is, I'm interested in joining an MRC. Which MRC do I participate in? Now, usually we join the Medical Reserve Corps unit in the county in which you live. So if you live in Hennepin County, you'll join Hennepin counties. If you live in Dakota, you join Dakota County MRC. However, if you're a student and you are interested in joining, let's say your university or college is based in Anoka County, You would contact that public health department and ask, oh, I'm going to school here. I'm here like 9 or 10 months out of the year. I'd like to join your Medical Reserve Corps. And in the chat, I'm going to place the website for anyone who's interested in joining the Medical Reserve Corps, whether it's, you are a faculty member and you're interested in joining your Medical Reserve Corps based out of your public health department, or you're a student who spends most of their time maybe in Hennepin County, but then you go home and you live somewhere else in Minnesota. What you do is you go to minnesotaresponse.org. Okay, and that needs to go to everyone. So I don't know if Lisa, you could put that in the chat for mnresponse.org. Perfect. So that way, when you're interested in signing up for the Medical Reserve Corps, you go to that website and that'll guide you through the Medical Reserve Corps that you would like to join. Again, if you feel like most students spend a lot of time at their university and you want to join the university where your college or university is based out of, then I would recommend connecting to the public health department in Anoka County or Dakota County. I also have a question. We can talk a little bit about this, but people often ask, do I get continuing ed for some of the training? And some of the training you do get offered depending on who's offering the training. So, it's free to join the Medical Reserve Corps, and then you get free training. Stop the Bleed is an amazing training. The Narcan training is amazing. Those are skills that help you outside of the Medical Reserve Corps as well. And some of those trainings depend on the jurisdiction and who's offering it. You do get offered continuing education. And then the other, I'm thinking of all these things, Brian brought up things that I can mention, is that liability. So if individuals who are registered in a MRC program, so let's say you're part of Ramsey Counties, and you are deployed, so that means you are officially deployed, then you are covered by their liability. And Brian, you can correct me if this is incorrect. Students, some of you don't have a credential or a license, and you're also really interested in supporting your community during a public health emergency. Once it's an official Medical Reserve Corps activity or deployment, you would be covered under the liability of that MRC unit. Is that correct, Brian?
That is correct. So a lot of times during a declared emergency, especially if the state sets it, they will take on that liability and workers' compensation coverage. Like I had mentioned in my spreadsheet, with our jurisdiction, we spent about nearly a year before the federal emergency ended in May of 23, talking about how we're going to move forward with liability in our program and who do we need to get signed off on that. And speaking with our risk compliance director and our labor relations director, as well as our county attorneys, it really came down for our jurisdiction that if there's a non-declared emergency, but you use your volunteers in a capacity like flu clinics, then it's on the department's responsibility to cover any liability. So we did have an incident where we had an individual who had a needle stick while at a flu clinic. So that person went to Minnesota Occupational Health and did the full gambit of workup and things like that. I did the interview as well with the epidemiologist and things of that, and with HR, and that was all covered underneath our budget and our unit. So our director signed off on, yes, we're willing to take on that liability so that our volunteers can go out and do this really good work in our community.
And along those same lines, I'm a registered nurse, and when we deploy nurses or anyone who has a license, their license also is protected once it's an official. So I want to make a comment about, the unaffiliated, or I mentioned earlier, when individuals went down when the bridge collapsed and individuals went down, without an affiliation, they weren't covered by any liability. If you were deployed to the University of Minnesota Medical Reserve Corps or other Medical Reserve Corps, as long as it's official, you are covered. And so, as I spoke with many nurses and pharmacists who worked at COVID-19 vaccination clinics, And they felt a lot of comfort knowing, you know, yes, I'm going to be here with the skills that I'm bringing as a nurse or a pharmacist. And that I'm also protected as a volunteer. And I think just let students, staff, and faculty know, regardless of whether you have a license, credentialed or not, that you're covered under liability. That's questions that we get a lot. I don't see any other questions. I'm going to stop sharing for just a moment. See if I can get that slide up. Okay. I can do it. Am I still sharing there?
You are not.
Okay, let's try this. This is the slide that I wanted to share with everybody. There must be a lot of anticipation now. It's not going to be that. So this is the slide I wanted to share. So these are photos of Medical Reserve Corps members in action. And whenever I look at these photos, I would see everybody looks happy to be there. You know, when we sent teams down to Katrina and Rita, so that's the individuals I'm standing next to the car, the van, you know, they were sent down and they stayed, you know, they weren't staying at hotels when they were deployed as an MRC member. In this scenario, members were sent down. And as you know, during the Katrina and Rita hurricanes, there wasn't hotels to stay at. So they would stay in a large gym on cots with everybody else. And you can still see that they're smiling, you know, they went down there, they had an experience. I get the chills thinking about this. So, you know, sometimes in some deployments, you'll go for a day and you'll come back, you'll do a 4-hour shift. If you're sent out of town, you know, the MRC will support that and they'll make the arrangements for you. And, you know, when I talk to individuals, you know, when they come back, their comments are, I felt like I got just as much, you know, as I gave, you know, really experiencing that, working alongside other professionals. There was a kinship there with these volunteers. And one of my favorite pictures here is the picture of the woman holding the little child, the toddler. And I always think about the impacts that Medical Reserve Corps members have on the communities that they're serving. I always wonder about that little girl, that toddler, who is now probably a grown woman, and hoping that, you know, the Medical Reserve Corps being involved and getting down to Katrina and Rita as soon as possible, that we were able to lessen the impact of that vulnerable moment for that child. So I just love these pictures, and wanted to say that, you know, I mentioned that oftentimes volunteers mention that their lives have been changed as well. And as far as student MRC members that have been deployed, they often mention how much they appreciated working alongside licensed professionals in their field of study. The comment I heard most from collegiate student volunteers was that they found the MRC provided them experiential learning opportunities that they would not have encountered in their normal coursework. So, you know, the Medical Reserve Corps program is a national program put together so that we can deploy individuals in their communities very quickly. So, you know, we're not going to wait for the federal government to come up and show up and respond to the emergency. We know in public health that emergencies start and end at the community level. So if we have individuals who are signed up ahead of time, so when you sign up for the Medical Reserve Corps, we know who you are, we know what your credentials are, what your interests are, and we're able to deploy you very quickly. It really enhances the emergency response around the country. So as Brian mentioned, there's 800 units all over the country, 22 here. So if you know you go to school, you can join the Anoka County. I can't mention them all. You know them now, Brian. But we work very closely together. Our MRC coordinators work very closely together. We can deploy across jurisdictions. It works very smoothly. And it just really, you know, in my experience with the Medical Reserve Corps for 20 years, it was the most rewarding work that I did in public health. We could assist individuals at their most vulnerable moments. And I get to work with volunteers who want to be there, who are volunteering their time and their expertise and skills. And so it's a rewarding experience on the volunteer side, and the communities and the individuals benefit from having individuals such as yourself faculty, staff, and students who say, yeah, I'm gonna look into this. I'm gonna sign up and register in Minnesota Responds and go to an orientation. And I believe, Brian, that the orientation is now online primarily.
Yeah, usually it's more of an email to get you your initial onboarding tasks. And then really that orientation that we do is really your first, deployment, whether you're coming out to pack syringe kits for us, or if you're coming out to a flu clinic, that's when we really do that, most of that orientation as well, to the MRC and things like that. But there are, we do send onboarding emails and things like that with various tasks that you have to do, like HIPAA training, because we want to make sure that we are protecting information, since we are serving, not only communities, but vulnerable communities as well.
So oftentimes I hear, from individuals who are interested, who hear this presentation, and they say, well, what happens once I sign up? So once you sign up, you get a welcome email from your jurisdiction. So it'd be from Brian. You get an email telling you next steps. And then you'll have opportunities for the training. You'll get emails, and oftentimes it won't work. I can't make the September one. I'll go to the Stop the Bleed in November. Or let's say there's an actual deployment, and a deployment is when we get a request for services from our Medical Reserve Corps, and we send them out to help that community. And so that step would be, you'd be used in training. And then let's say you get an email or a text that says, we need help with flooding in this community. We're responding to this flooding, and we're going to be doing some, I'm just using an example of something that's been done in the past. So we go from home to home and we hand pamphlets to individuals about how to keep safe during flooding, what to do, what vaccinations you might need and such. Let's say you get that email and it says, we need, 40 individuals to work out in our community. You have the opportunity to say, I don't have to, and you don't have to respond. You don't have time to do it. So this is a volunteer organization, number one. Number two, when you show up, it's a very organized response. We follow and use the system called the National Incident Management System. So you will know incident command. So you will know exactly who you should report to, where you report to, who you're going to be working alongside. We don't send you off alone. We like to send you with a partner in a group. You'll always know who you report to. When do you take breaks, what your assignment is. So this is a very organized system of the Medical Reserve Corps, the training, the deployment. Following the deployment, we may follow up with you. For instance, when the University of Minnesota deployed several dozen of individuals, Medical Reserve Corps members, down to Katrina and Rita, we checked in with them afterwards, and we wanted to know, about them. How did this affect their mental health? And did they need to talk to us, or did they want to have time to talk to a counselor? So we take behavioral health or mental health very seriously, not only for the communities that we are serving. Hence, that's why all Medical Reserve Corps members are asked to take psychological first aid, which explains to you or teaches you how to interact with individuals. We take responder health very seriously as well. So any Medical Reserve Corps member who's deployed, the MRC coordinator will stay in touch with you. If you have any issues and you're really impacted, let's say you're impacted, you're really struggling afterwards and you need someone to talk to. That's the Medical Reserve Corps coordinator's job, to connect you with someone or make sure that you're supported in every way during your deployment. I don't know if you have anything to add to that, Brian.
Absolutely. So I do have a couple of things to add, going back to the first one about college students being away from their homes, right? So for our jurisdiction, what we look at is, so usually, typically, we do want residents volunteering, but we know that there are so many people in our community that are stakeholders that may not live in our community that really want to be able to support in a time of need. So that's why that's why we've kind of broadened it a little bit to students or residents who are stakeholders in our community for really recruiting and jurisdictional. And then I also want to talk about the reward that you get for being a volunteer. So being in public health and the way bureaucracy can be sometimes and how slowly things can move, sometimes we get a little disenfranchised with the work we do, but being a part of the MRC and actually being able to see that our work is having a direct impact on people is some of the most rewarding work I've ever been involved with. And I am eternally grateful for this role. I love my volunteers and I try to support them as best as I can. And it really is a give and take relationship, getting to know your volunteers and their skills and what they're comfortable doing. And then finding those opportunities for those responders to be successful in the program. And then also to help turn community trust, because we know historically many communities have been mistreated by public health agencies. So really getting out there and showing that presence and being committed and continually showing up, it allows us as public health professionals to build that trust in those communities and have more early adopters to vaccine programs and things like that, and really just build the health overall of our programs. So again, some of the most rewarding work I've done. And although my public health career has not been very long, if I might add, but of all the work I've ever done, I've never had a job that's been as fulfilling and satisfying as my role in public health and being a volunteer coordinator. So I'm eternally grateful to mentors like Kathy, who helped me in the beginning get my bearing as a coordinator, and our metro coordinators and our state coordinators and things like that. It's really a great program all around, with just really genuine people, and that you can make, potentially lifelong friends with. So
Thank you, Brian. Yeah, it's a very collegial experience when you're out in the field, or even when you're in the training. You're rubbing shoulders with people who are in your field, or where the field that you're studying for, and everyone there. There's a kinship there between volunteers, because it really takes an interest in being of service to your community, and you all have it, and you're all showing up. I feel the same way about the Medical Reserve Corps, and it's been an honor and a pleasure to be involved in it. I don't see, let's see. I'm also going to add, I see we've added some information in the chat about our final webinar, which is on crisis communication. Lily McDonald, I highly recommend joining us. She is a very engaging speaker, and speaks all over the country, and she will be speaking to crisis communication. I'm also going to add my email address. And I would encourage anybody who is interested in talking to me about the Medical Reserve Corps. I can connect you to others. So let's say, you want to ask more questions about in the jurisdiction that you're in right now. I think it's okay for me, Brian, to say that I know these coordinators well, the MRC coordinators, especially in the metro area, and that I will be able to connect you to those individually. And then let's see, I think if you could share this, Lisa, to everybody. That is my direct email address. And following this presentation, or those of you who are going to be viewing this webinar at a later date, please reach out to me. And in the subject, like you could say, interested in MRC, and we could have a conversation together about that, either through Zoom or a phone call. This is something that I, along with Brian, have it's a very rewarding program to be involved with, and I also think it's a really a valuable experience for students, and that's the feedback that I've received from the students that have been in the MRC. I know there's an MRC, a student who was in the Medical Reserve Corps at the university. They were in my student advisory group, and now they're faculty at the College of the University of St. Catherine. So we stay in touch. We join, it's a good way to network, and just really recommend it for faculty, staff, and students as well. Check to see if we have any questions here online. See any questions? And so again, thank you so much for joining us now. And for those of you viewing at a later time, we're so glad that you were able to spend this time with Brian and I. Again, feel free to reach out to us. And this webinar has been recorded and will be placed on the the curriculum hub, and so faculty will have access to this if they want to show it to their classes. If they're talking about, you know, how the workforce, public health emergency and response workforce, you know, actually functions. You know, we have public health individuals in a department that are emergency preparedness and response. And we really consider, you know, the volunteers part of the workforce. You're an integral part to how we were able to respond to COVID-19. And I can confidently say that their response would not have been as effective if we wouldn't have had individuals in the MRC who were willing to serve as vaccinators. We had many individuals, hundreds of individuals who are not licensed or credentialed, who supported those vaccine clinics. And so for those of you who are not licensed or credentials yet, the Medical Reserve Corps, sometimes I think of it as a misnomer, like it's Medical Reserve Corps. However, oftentimes half of the individuals in a Medical Reserve Corps unit will be non-licensed individuals, individuals who are really interested in logistics. So people who are able to set up the sites and support the deployment that way. And so students, again, you do not have to be credentialed or licensed to be a part of this Medical Reserve Corps. So I encourage you to check it out, minnesotaresponse.org, or reach out to myself. Thanks again for joining us, and we'll see you hopefully at the next webinar.